Hello and welcome to the Skin and Bones podcast. My name is Dr. Zachary Hill, the bone side, and this is Dr. Peter's Gust, the skin side. This is our podcast. Thank you for joining. Peter and I are two good friends that go all the way back to med school in two different perspectives of medicine, but and a little bit different stage. And we're just here to talk about medicine and life. How you doing, buddy?
I'm doing good. This is a momentous occasion. This is our 10th episode. So
Ooh.
Round numbers are always good to talk about, I guess. But
I was 33 in college. I don't know.
So yeah, 10th episode. Everything's going good. Had a good week at work. Just hanging out, relaxing with Cynthia. Got a chance to go to church today.
Nice.
Yeah, not
too
Megan's
out
shabby
of
at all.
town. We didn't really see each other at all as much. It was a really busy week for me, and she works nights. And then the night that she was off, we got to spend that night together, but like she left for her family's the next day, and I was like really tired when I got home, so there wasn't much conscious time.
Yeah, for sure. Anyways, love catching up when we can and making these podcasts, and
and so
to get another one in the books.
Yeah, the thing I wanted to talk about today, I was thinking about it. I sit on residency application committees, and this was my first year doing it. And one of the things that is kind of, you hear it as a weed out, is your step one score. Mm-hmm. And this is the last year for applicants to have a step one score. For those of you who don't know, there's a step one, which is historically when we were in medical school was the big test that if you wanted to do something competitive like plastic surgery, dermatology, orthopedic surgery, you would have to score very high in this test because programs would use that as a weed out tool in order to take their application class from 800 applicants to 300 and actually make it more representable. I know they do that for orthopedics and certainly dermatology and other competitive subspecialties. And so next year is going to be the first year that score is not taken into consideration.
It's already happened, I think.
No, but this is the first application. Next year is the first application class. Yeah. So it's already happened. So I wanted to talk about, Peter, first, like, what are your thoughts about step one not being scored, and kind of talk about like your experience with step one and what that was like for you?
Yeah. So step one, we usually take in, it's at the end of our second year, Zach. It's really like
and a second year. Yeah. Some programs are different, but I think
it was the end of, I took it the end of second year. It was a incredible time for me because I took step one. It's all coming back now. And then I got married a week later. So everything was kind of culminating, a lot of big things in my life. When you talk about a test, you talk about finals, you talk about things like that. This test had so much unnecessary stress associated with it because basically it decided what you were going to do within medicine for the rest of your life, give or take. It kind of closed certain doors or it opened certain doors depending on the score that you got. And what Zach said, it was true for the most part. Programs would need to use, they often did kind of historically use that as a baseline to help weed through certain applicants and set a benchmark. I believe Zach put it that way. But yeah, as far as the experience for me, it was an incredible time of just like discipline and learning how to just study for not only passing the medical school classes, but also just be doing board prep questions and how that all intermingled, and just kind of, it was one of the most stressful times I can remember in medical school because of all that was riding on it. The fact that they now made it a pass or fail test, I don't know if I have the best perspective on it looking from the outside in now, because it's a completely different ballgame. I think that definitely step 1, 2, and 3 are the licensing exams, the USMLE step 1, 2, and 3, which Zach talked about and kind of explained a little bit. Step 1 historically has been the most important one. It's like an 8-hour test, something like that. A lot of basic science, random things that you will never see again in your career as a doctor. But for one reason or another, like historically, they thought it was important to learn certain things that are going on inside of the cells that aren't going to necessarily impact your clinical decision making. As far as getting rid of the scoring, it was a bit shocking to me at first. because so much weight was put on it in my life. Just as human beings, we have a hard time looking at things that are outside of our viewpoint, just as human nature. Because I mean, to us, it was everything. We would stay up till
Right.
midnight studying as a group, and
Yeah.
it wasn't just like oh, most people pass it, we'll be fine. It was like you better, if you go to bed 30 minutes earlier, you're gonna not get those 5 to 7 questions of board prep in, and that could mean 1 or 2 questions on the test, and that could mean a couple more points. That sort of situation was always like in the
Yeah.
back of your mind. That's not there anymore. With that being said, I don't think that we should be using step 1 necessarily as a benchmark for what makes a good resident, because having gone through residency now and having gained that perspective, having gone through residency and now being an attending, practicing on my own, I just don't see the correlation between someone who gets a high score on a test that has a lot of things that aren't applicable to their day in and day out work. As a resident, I've seen amazing residents that maybe didn't have the best step scores, and I would take them in a heartbeat over a lot of people that I
Right.
know had crazy high step scores. And
Yeah.
I know you have a lot of opinions about this. It's hard to, and I've talked with program directors in different specialties about what are we supposed to use as far as a benchmark to kind of figure out who are the good applicants and who aren't. And it makes it tricky when you don't just have a number to look at. You have to look at the entire application,
Right.
and it kind of forces you to do that more. I think they're using step 2 as kind of almost a replacement of step 1 now, as far as like looking at a number score. So I don't know how much of a difference it actually makes in the end,
Yeah.
but it's forcing programs to look at the entire person, which is great because you want the best person that's going to fit into your program. Not
Right.
everyone's going to fit in at Loma Linda. I wouldn't have
Yeah.
fit in at Harvard. I
Right.
wouldn't have probably fit in at NYU or UT Southwestern. I probably wouldn't have fit in there. I am so happy I trained where I did. And I think that the way the system worked out, it worked out to looking at my whole application, even though I did fairly well on step 1. It's just,
Right.
yeah. What do you think about all
Yeah.
that?
That's a really good perspective of it. I think I agree, but kind of disagree in some certain areas, right? Like
Mhm.
we go through undergrad and all these things where it's like you got to get A's and the pressure's on to do that, to get a good GPA and all those things, to get into medical school. And then this is kind of like the culmination of like what you want to do. And it's
Mhm.
sad that it kind of is like that, where it's like you have to perform on this one day for
Yeah.
8 hours. And what's on the test is absolutely everything in medicine.
Yeah.
How it should function, how it doesn't function, to the molecular level, to the clinical level.
Mhm.
It is a lot of information. And I think the only thing that, it shows is what you said earlier, is discipline. And I
Mhm.
think that for the majority of people who had discipline, no matter how smart you were going to do well on that test, because there's just so much information that, you and I know extremely smart people, like people who they just see something and they understand it
Mhm.
and they grasp it. And that's a very, very small amount of people.
Yeah.
Most people in medical school are intelligent, but it really takes discipline to gather all that information and use it and reproduce it in a reputable way that you do well on this test. And so I think it serves as a marker for how much, for the majority of people, for the vast majority of
Sure.
people in medical school, of how much discipline you have to understand this information.
Mhm.
Like you said, it really doesn't apply clinically, like glucose cerebridase and
Yeah.
whatever that caused,
I mean, a lot of pharmacology on it and things like
right.
that.
But
I mean,
it's just,
basic stuff. It helps to
yeah,
build a framework.
yeah. And I think it just shows that discipline.
Mhm.
um but I think you're right. I know a lot of residents who probably didn't score well on boards, but geez, they're really smart people, and I trust them with my
And really
family. I
good
trust them
doctors.
with
Yeah.
great doctors.
Trustworthy people. Yeah.
Oh yeah, and it's just like, for instance, I'm one of our good friends, Bronson. He
Mhm.
kicked the plug out on his day that he
I
took the
remember
test.
that he's good. I don't know if he listens to us or not, but
Yeah, and I remember talking to him. He's like, it's probably the best thing that happened, because he didn't score the way he wanted to. He wanted to go into ophthalmology, and now he's an anesthesiologist, and he's an intensivist anesthesiologist, and he loves it. Right? Like, there's always these, and he's a great doctor, right? I trust him. Like, he's just a hardworking guy, and he's very
Mhm.
smart. So it's like I don't know how, from a perspective of application and getting into a good program, like I don't understand how you do that now. And I think the
Yeah.
error is really on the application system, right? Like you are available to apply to any program. And the thing is to apply, it's just money out of your pocket.
Hmm.
So in people's perspective who are trying to get into plastic surgery, dermatology and these really competitive residencies, it's like, I've worked this hard to get into this competitive residency. I'm going to shotgun it to all of them, even though I might not have, I might not want to go to Harvard. Like you said, I'm not a Harvard guy.
Yeah.
I'm not this kind of guy, but I'm
That's
still going to apply there because I need to apply to every program. So, because it's so competitive
uh-huh.
that I need to just see how many bites I get in the interview trail.
Yeah. They're
And I
trying to
think
change the culture.
I really hope I think that's the part that needs to change because
Hmm.
honestly, like I knew it was competitive, but if I could only apply to 30 programs, I would have. I mean, that's what I did for fellowship. Then you could take fellowship where it's like you have 80 or so programs. You'd be like, you
Yeah.
know what? I don't really like these ones. I don't really like these ones. So there's no point in me applying to them. But
Sure.
I like kind of like what these ones have. So I'm going to apply to these. And it's a lot more open that way because they
Sure.
know you're an orthopedic surgeon, right? They just need to see if you're a fit for them for a year or
Yeah,
however
and
long it is.
statistically, I mean, we preach like statistics and like clinical significance all day long, but when looking back on it and just kind of shotgunning approach to residency programs and applying to all of them, statistically, like your chances, the place you're going to match is either at your home program or places that you did away rotations at,
Right.
far and away
Well, now you can't do
statistically.
those, right? With COVID. And that's
So
what's
that
even
throws a whole new
harder.
curveball. Yeah.
Yeah.
So
I mean, they're
it's
just
got to be
starting
an
to open it, but
interesting time to be a med student right now for sure.
yeah, I mean, I do remember those nights, man. Those nights were long nights, but I'll remember them forever. Just our
Yeah.
group of friends in your living room, laying on the couch, some of us like taking breaks. I remember Daniel playing, FIFA and we're all studying and we'd all just like stop and someone would ask a question, we all discuss it and then go back to our studying and then
Yeah.
at the end of the night, we'd have maybe an alcoholic beverage. Hopefully, nobody from Loma Linda and the administrative side is listening to this. But we'd have a beer, and we'd all bring something, and we'd try others. And I mean, it was like a bonding experience that until you go through it, you'll never quite understand it. And
Mhm.
it's very true. I remember someone telling me they're like, "You'll never study this hard in your life." Ever again, and you'll never know this much information in your life ever again. That's
Yeah.
like that broad. And I was like, yeah, that's true.
Yeah. The brain's kind of a cool thing that it prioritizes what you do and what you don't need to know right away. The more you practice things, and that's why it's the practice of medicine too. You're constantly like weeding through all the information in your brain and picking out the right choice. And based on your experience, a lot of the time you just have a knee-jerk reaction that you know is correct based on what you've seen in the past, and you correlate it with what you read in a book. And it's pretty cool, the combination between hands-on experience, clinical experience, and then all those late nights in the books.
Yeah,
Yeah, it's hard. I will go back to your point about discipline though, and I think that the standardization of medical school curriculum and making sure that people are able to pass their classes, I think that is a large, like, I mean, that people have to be disciplined to get through the med school classes in general and do
totally.
well on them. And I like historically there too, I don't think that programs tend to look at those grades as much, and different programs don't give grades. Some just give pass fail, some give honors, some give like high
Yeah,
honors, all this stuff. And I don't know if it's more standardized lately, but I think that if it was a little bit more standardized across the board as far as med schools go, that could be just as easy a sign of discipline in a applicant as just one test on one day. Where I mean, in Bronson's case, he kicked out the plug and he lost all that time and it cost him.
yeah.
And so, I mean, we love you, Bronson. Sorry to
We love you,
to
Bronson.
bring you up. He won't
He's so
care.
much more
He won't
happier.
care.
He's
He won't
so
care that
much
we're
more
talking
happy.
about it.
Yeah.
Um,
Uh, yeah, but I mean, but in the end, me, I love competition. I think that competition's great. I think it breeds success. I think it breeds innovation. Um, so it's like I kind of have mixed opinions about it. And I really wish that people can narrow down how many places they apply to, like cap it at 30 and just say,
mhm.
hey, and it would really
Ooh,
narrow the field. And so if you didn't get enough interviews, maybe later on you can open it up to secondary interviews or something of that nature. But
sure.
I think the way it is right now, you're taking away from really good applicants who might be better fits for places, but they're afraid to apply because of their board scores. And that's, hopefully not an issue anymore, but I think it's still just going to come down to something else, unfortunately, right?
Sure.
Like your steps 2 score, or how many pieces of research you have, minimum of six things of research, which is insane, by the way.
Yeah.
That could be another topic for another day about the research
Sure.
requirements and things of that nature. But
Yeah.
unfortunately, there's going to be another hurdle for any
Yeah.
competitive residency.
There will be. They'll find something to stick a roadblock in the way. I think it's so interesting looking at things from a medical perspective, because that's what we know. That's all we know. And then kind of talking to friends who are in the corporate world, talking about how they're constantly trying to look for ways to basically get promoted, or they just move on to new jobs so quickly. And I think that's definitely just a sign of the times we're living in. But just seeing how the corporate world is so much about like selling yourself, but being okay with moving on to the next thing. And in medicine, like going up through medical school and residency, I mean, you're trying to sell yourself and say, hey, I have this many publications, I got this score on the big tests, like you should see all these nice things that all these mentors said about me, yada yada. But at the same time, you don't get a monetary increase from it. You basically just get a good training program. You're like begging to be trained by a good program. Whereas in the corporate world, you're doing all this stuff. You're like increasing, like buffing your resume and like getting all these certifications for all these tech companies and things like that, so that you can make more money. So much of your time in medicine is just like so that you can train at a certain place that isn't necessarily going to make you any more money from a financial aspect. It's just more of a prestige thing.
I know, right?
But that's a complete different angle.
Yeah, you can graduate from the quote unquote best residency in your specialty, and you're still starting out at square one again, and you're like, great, I'm 30 something years old and I'm starting at the bottom, even though we do get a substantial amount of pay for our job, which I agree with what we should get, because not everyone can treat human beings. But it's just like you're 33 and it's just like you're just starting out your career and you're starting at that base level for it, and you have a substantial amount of debt. Yeah, but now we're getting off topic.
Oh, we're so way off topic, because I wanted to bring up like the amount of pay versus the liability, but that's definitely for a different day.
Oh yeah, that's gonna be
kind of to throw a curveball. I like throw the biggest like topic change curveballs. Cynthia and I went and saw the new Batman movie today.
Are we in this?
Whoa, do you see that left field that's coming out of left field?
Jeez almighty.
So if anyone is on the fence about going to see the new Batman movie, just completely avoid it. Completely. Just don't waste the 3 hours of your life and the 45 minutes of ads.
Was it really that bad, or are you comparing it to the previous Batman franchise? Not like with Ben Affleck, because everyone knows. I didn't even see that. I was like, no way, no, too soon. I'm talking about the Dark Knight.
I'm comparing it to just being like some semblance of entertained during the entire 3 hours.
Wow.
It's just this is the first time I've ever fallen asleep, I think, at a movie in a theater.
Oh, wow.
And it wasn't because I was like necessarily tired. I was just like, wow, it is dark in here and nothing's going on. It's extremely slow. They basically tried to make him like this really grungy, emo, dark form of Batman, but then it's just nothing was flowing right and everything was taking forever. And I was just impressed about how bad it was. And I'm not even like a huge movie critic.
Impressed about how bad it
was. Yeah, Cynthia's like, can we get our 3 hours back, please? Wow. And it was like so long. So I wanted to just do a public service announcement. Listen to what people are saying and don't go see it. Because Cynthia and I were like, oh, we should be adventurous. We should just make our own opinions about things. We're not going to listen to the majority of people that are actually saying how bad it was. And so sometimes it's good to listen to the advice of others, and just a public service announcement.
All right. Well,
you have anything else out of left field or right field?
Thanks for giving me time to even comment on that. You just made that all about you.
Hey, well, you didn't see it. You told me you didn't see it.
Actually, you did make it about me because you're looking out for me and everyone else who watches this. So that's good.
I am looking out for you. I mean, I am partial to the Dark Knight, and Christian Bale is a great Batman, but this one is just I hate to say it, but I mean, he was better in Twilight. He was better in Twilight. So
Man, I have bad. That came out in high school, and
yeah.
all the girls in high school like loved those two. It was, what was it,
Mm-hmm.
Team Edward and Team Jacob? God, I remember this. Oh my God. Ugh. Anyway, like, yeah, I just remember that was a thing. Remember that was a
Mm-hmm.
thing? Oh
Oh, for
my
sure, man.
gosh.
They'd have TV commercials like Coke, Coke commercials and versus Mountain Dew or something. Or like Taco Bell would have commercials, Team Edward and like cups and stuff. Oh, we are so, do we even have a topic at this point?
No, we don't. We
I
were
love
talking
it.
about, remember, step one scores, and then we're
I
we're
know.
we're here now. Taco Bell.
I
We're talking
think
about
just
Taco Bell.
knee jerk PTSD from step one, it told me it's like you need to talk about something else.
I
You
don't
need to,
think so. I thought studying for step one would be PTSD. Holding the pager in our hospital when you're there at night and that experience, when I hear that pager sound, my heart rate goes up. Like, I just,
mm-hmm.
there's just so many thoughts of just tiredness
Yeah.
and anger
You're
and just
Pavlov's
like
dogs right now, dude.
so bad.
You're
Yeah.
so conditioned. Like when the bell
Oh,
goes off, your pager, you're just like, whoa.
that's not my response. It's more in here it's different words.
You say very pleasant words that are suitable for all audiences across the
Yeah.
world.
Yeah. I love
Um,
treating patients, but man, sometimes that was, I never ever would have thought in my life that I was like, I can't do something, but I'm like,
mhm,
I don't know if I could do this. Like, that was so challenging. Like, I think
yeah.
there's only like two things. I think the first week of medical school, how much I was studying, I was like, oh my gosh, can I do this for 4 years? Like
Yeah.
that. And then when I was on night float, which for us is you're the only orthopedic surgeon in a level one trauma center, and you're responsible for all the consults that come in and all the patients on the floor,
Mhm,
and you're so busy. And I just remember, like, after the first week, I was like, oh my gosh, like, this is just like, I mean, there
yeah.
were nights I didn't sit down. Thank goodness I made friends with the nurses. They'd see me running around the emergency department and they'd hand me water.
Drink it and
I
go.
would I would come home and I'd cramp up in my calves because I just, I my the first 5 weeks that I was on, Megan came up to me and she goes, I lost so much weight. She goes, you look like you have cancer. I was like, thanks, babe. Appreciate
And
it.
that's it's a supportive, loving relationship we've
Oh,
always wanted. So
but to go
I
back now,
know.
to
I'm just
now, here's Mr. I'm reconnecting the dots. Okay.
let's bring it
To
back.
go
Let's bring it
back,
all the way back around.
the time and discipline it took to study for step one, and all those hours and nights of just saying, yes, I could go to bed or take the easy way out or not cover this or not do a couple more questions, it paid off, because those nights where you're just work to the bone and you just, it gives you that extra push. It gives
Mhm.
you that extra push. And so many people who are outside of medicine always talk to me, how do you operate at all nights? How do you go 24, 36 hours straight? And I'm like, because patients don't wait when you're on call. Like, if things come in that are bad, like, you need to be able to keep focus,
Mhm.
and do the best thing for the patient.
Yeah.
And so it's like, you need that training. You need that, as much as it sucks, as much as it stinks, you need to have that beaten into you. So you don't just say, oh, that's good enough. I'm tired. I want to go home. Like, you can't
Mhm.
do that. So
But even within medicine, I can't do that. So I chose not to do that. So I mean,
and
so
you scored very well on your step scores.
so that's the other thing is like everyone kind of hits their limit. And I think humans are incredible people who can push their limits.
Totally.
But they're also incredible people that can kind of choose which way they want to go, and foresee how much of their limits they are going to have to push in a certain instance. And that's why a lot of people pick certain specialties. But kind of bringing it back around, trying to help Zach out, with the step one
Oh, where are we going
conversation.
now? Where are we going now?
No, we're going to step one still. It's just a lot of people, that decision was taken out of their hands and they ended up
Totally.
getting
Okay.
pigeonholed into something that they didn't like, they didn't ever want to do. And they actually like even if they had the motivation, if you're doing something that you actually don't love doing, you're not going to take that extra step. You're not going to put in that extra effort. So that's why step one was hard. I mean, you have to have the motivation to get the score, but then like if for whatever reason you don't, sometimes people get pigeonholed into something they don't want to do, and that's just a recipe for bad patient care and a bad like provider mental health. I mean,
Yeah,
I don't know.
I hear where
You can
you're
look at
coming
it from
from.
so many different angles.
Yeah, no, I definitely hear where you're coming from, and I don't think there's a right answer. I think it's just challenging no matter what way you look at it. You gotta. I think I honestly think my solution is to narrow down how many places you can apply to, and that's because you know what, the people who are brainiacs and want to go to Harvard, go for it. I'm not that guy. I'm a guy I want to work hard and I want to operate and I want to be a good operator. That's all I want to be. Research, those things don't matter to me as much. Prestige, I don't care about. It's just I want to be good at what I do and at my craft and help patients. And so that's why I chose the program that I'm at, because I knew I'd get it. And that's why I didn't apply to Harvard. And so
we talk about Harvard a lot.
Yeah, I know. It's like Harvard's always it's that Americana gold standard of education.
Yeah,
I mean,
I'm going to Boston
ever since
for
I
a
was little,
conference.
That's what I heard.
Up.
Harvard.
Yeah, end of this month, I'm going to try and visit Harvard for the first time because we're going to Boston for the American Academy of Dermatology conference. Hopefully, I'll see some of you guys if you're listening. Some of my dermatology residency friends, mentors, anybody that does listen to us. It's going to be a good time. I've already reached out to a couple people who are going to be there, and Cynthia's excited. We haven't been to Boston before, so we're excited.
Cool. Yeah, I will not be going to the American Academy of Orthopedic Surgery at Chicago coming up soon here. I went to San Diego, gave a couple talks this last year, but that was fun. You meet a lot of people there in your field, and it's really cool to be in such a one location with everyone who's kind of in your field, and it's really interesting. I know, for you, it's like, for us, with all the implants we use in the different companies, there's like this huge showroom. I mean, enormous showroom of all the latest technology, and everything from positioning beds to imaging modalities to implants to just anything and everything you can think of in orthopedics. It's pretty cool. And it's a great experience.
Medical conferences are a great place to network. I think they're most useful for networking, to be honest, because if I want to learn something, I'm going to look it up on the spot and I'm going to look up the data that's on it. It's helpful to listen to lecturers who are big names in the field, who have a lot of experience. It's just I'm more of a hands-on learner, and I'm definitely going to go to some lectures and I'm going to learn some things, pick and choose things that I want to brush up on as far as the lectures go. But really, I feel like networking at these conferences is a huge deal. Making friends and just making sure that you're building bridges with people within the field, because if you're networking, you can have so much of a reach to help your patients, because if you don't know something, they might have the resources or the wherewithal to help you get something for your patients or things like that. So I view networking as a huge positive side, even for patients, by going to conferences. That definitely doesn't count necessarily as CME credit, but it's definitely worth its weight in gold.
Yeah, well, that's good.
Yeah,
I'm glad to hear that.
Well, anything else you want to talk about?
No, man.
Got the window open behind me. It's kind of stuffy up here. I left the heat on, and then all the heat, I guess heat rises. I don't know if any of our listeners knew that, but heat goes upstairs. It doesn't stick around downstairs.
No, I think we're going to Georgia for my fellowship, and Megan and I have decided to sell our house here in Sacramento. So that's a big thing, and we're getting prepped for that. And so, we're excited. It's getting closer. It's almost here. Sooner or later, this podcast will be done in Hotlanta, Georgia.
Yeah, man.
So I'm looking forward to that.
Well, that's great. I need to figure out what we're getting for dinner. I'm probably gonna order some pizza. I've been into Detroit style pizza lately. Do you know what Detroit style pizza is?
Just your turns are so good. I love it. I can't get over it.
Hey,
You're the
I'm
king
about
of.
facing right and left, man. There's no, when we started this podcast, we're like, yeah, we're gonna talk a lot of medicine, but
Yeah.
for me, I
I
like to
don't know
talk
what
about
Detroit
random stuff
pizza
too.
is. What's Detroit pizza?
Oh, Detroit pizza is where it's not deep dish. It's not, you know what Chicago deep dish is.
Yes.
It's like lasagna. It's
Yeah.
Giordano's, it's Lou Malnati's. So Detroit style is a little bit, it's thicker. It's made in a pan. It has very crispy edges. And usually the sauce is kind of on top a little.
Oh,
Yeah. We're gonna have to leave a link to the Detroit style pizza.
where do you get it from?
So there's a couple places around here that have really good Detroit style pizza. One place called Love Supreme, which is really good. It's got nice, cute Instagrammy vibe. So Cynthia likes to go there. And Via 313 is another place that has good pizza over here. But a lot of smaller places, kind of local chains have it here. But I don't know. I did get a gym membership, so I'm able to eat a little more pizza now. Cynthia and
That's
I finally.
that never stopped you before. Okay, so you get a gym membership, and then you're like, "Oh, babe, we get to eat more pizza."
Yeah, because it's been the Peloton pretty much solely, but I'm trying to get a weightlifting routine down
There
and
you go.
trying to get some benefits of some resistance exercises too.
Good.
But yeah, there's a local gym. It's probably a little bit of a step up from Planet Fitness, but I like, at least it's local. I
Yeah.
got a couple of basketball courts too. Might shoot some hoops with some
There you
people.
go.
And I remember playing at Loma Linda with you and your huge knee brace.
Oh yeah, man. I don't leave home
You would
without
regret
that.
it
I'm
every
active.
time. Every time we played, you would be like,
Yeah, I was just like,
"Why?"
ah, my knee hurts so bad. Yeah, I try to stay away from that. Well, that's good. Yeah, I'm looking forward. I got one more week left on trauma, and then I start my elective up here locally. And so I'm looking forward to that. I'm looking forward to my elective one for
Mhm.
multiple reasons, but one, I'm gonna finally be back on like a normal schedule for the rest of the year. Because then I end the year with sports medicine, which is a little more structured elective surgery clinic, and then studying for board. So I'm really, I'm a person of like cycles. I mean, are of very standardized, like, hey, this is what my day is going to look like.
Mhm.
And trauma's a roller coaster. It's very early mornings, sometimes very
Yeah.
late days, sometimes early, but then you're like, oh my gosh, I've been working so many hours. I really would like to go to sleep early so I can catch up on my sleep, and I have to read this,
Yeah.
so it's like having that come up, and I'm really looking forward to, and it's going to kickstart me going into fellowship. And yeah, it's interesting for those of you who don't know. So I'm on trauma right now, which is open surgeries, big surgeries, broken bones. And sports medicine is a lot of arthroscopic surgery, where
Mhm.
what that is you use a camera and small instruments to work inside of joints, and it's a totally different feel from all of the rest of orthopedic surgery. Whereas it's scalpel retractors, things like that,
Mhm.
for trauma. But for sports, it's very fine movements. It's hand-eye coordination, it's dexterity, it's very small
Finesse.
movements.
Finesse.
Yeah. And
Yeah.
so actually last week I did a day, because sports medicine was short a resident and we were plus a resident. They're like, hey, do you want to go to sports? I was like, heck yeah. And I went over, and it's just like, I felt like I was just like, whoa, like I need to get my hands right again, because like it's just a totally different feel.
Uh-huh.
And that's what I'm going to be going into for the rest of my life. So I'm looking forward to just getting that feel back, and going forward from there.
You're gonna rock it, man. That's
Yeah.
awesome.
Oh, for sure.
Yeah, and kind of the way Cynthia, because Cynthia works per diem, and a lot of times when she was working in the hospital, she works at outpatient surgery center now, so it's a little more kind of steady. But when she was working per diem in the hospital, like she may not know whether she was going in like until the night before and things like that.
Right.
And I've told her so many times, I was like, I don't know how you do that. That would drive me nuts, because I am
Yeah.
exactly like you say. What bothers you about trauma is the lack of predictability, because
Yeah.
I like to have things be predictable. Obviously, you're gonna have to adapt to things in life. That's
Yeah.
gonna happen. But if you can minimize that and just get your routine down, there's a certain stability, and there's a certain comfort in that, to allow you to deal with variances outside of that a little bit easier, instead of just like with your job, just wondering what next curveball is gonna come. So I feel you on that. Yeah.
Yeah. So yeah, man, I'm looking forward to that. And it's hopefully just going to be a smooth transition. I'll be a lot happier and perkier and more rested. So yeah, I'm looking forward to that. And yeah, man, what's
I
going
like
on?
it. I like it. Yeah. So in the business of public service announcements, if you are still using tanning beds or thinking that tanning underneath the sun for extended periods of time without sunscreen is a good idea, my MA would disagree with you, because I had a patient come in that we did 14 biopsies on,
Oof.
like it was nothing in the middle of clinic. We were running out of like
Blades.
specimen bottles.
Jeez.
But for real, guys, like it's a big deal.
Yeah.
I mean, melanoma is no joke, and I'm wondering if a couple of them is probably going to come back as a melanoma on this particular patient. But yeah, it's just if we're in the business of public service announcements today, don't mess around with the sun. SPF 30 or more every day, on the face, at least, if you want to look pretty for a long period of time and you don't want fine lines to start and brown spots to pop up. And then reapply every 2 hours while you're outside if you're going to be at the beach or in Cancun, like Zach and I were one time a long time ago.
I
You
got
like my
my own,
PSAs? I'm gonna call
since I'm
this
on
episode
I'm gonna
PSA.
I'll do my PSA since I'm on trauma right now. If you're thinking about speeding at excessive speeds in a motor vehicle or on a motorcycle, please don't. If you're thinking about drinking or doing any sort of drug and then getting behind the wheel of the car, please don't do that. If you're thinking about doing meth, please don't do that.
Yes.
If you're thinking that going outside and fixing the roof in a windstorm on a ladder is a good idea, don't do that.
We
If
should
you're
have had this the
thinking,
whole episode. Things
yeah,
you shouldn't do based on Zach's trauma rotation. Let's keep this going. I
if
like
you're
this.
thinking about using a skill saw to do anything besides cut wood in a non-controlled environment, please don't do that. The whole drugs and alcohol thing applies to using a skill saw.
Yep.
Don't use those if you're using a skill saw.
Just use that as a blanket thing. Maybe
yeah.
drugs and alcohol while doing anything, or just avoid it completely. I mean,
Yeah.
that could always be a good option too. Yeah.
Speaking of, a week and a half in
Good.
on Lent, so I got my bubbly tonight.
Oh, okay. You got the nice bubbly. I got these Bai
Nice
lemonades.
Nice.
Cynthia is not a huge fan of it, I discovered today, probably because it's got stevia. I was wondering how it was sweet.
Who's
Yeah.
stevia?
Stevia is an artificial sweetener.
Just kidding.
Anyways, okay, what else we got? What else we got as far as things to avoid? Well, if you don't want to end up under Zach's trauma care.
If you're in a bar and are going to get into a fight, which again, this goes back to alcohol, don't punch someone in the mouth and have them cut your hand. That will get infected.
Ooh, human bites are the worst too.
Yeah.
Human bites are bad.
This goes back to the whole drugs things. Don't inject drugs. Not good.
Yeah.
If you are older, take your blood pressure before you take your blood pressure medication. Sometimes it's low, and taking that medication can drop it even more. So when you stand, you will fall.
This is so good. Why didn't we think of this earlier? I like this. See, sometimes when you take like complete 180s and change the topic, you come up with gems like this. This is a complete gem.
Let's see. I stay away from dogs off leash. They will bite you. So let's see. Don't be in a gang that is violent and shoots people. It's almost swimming season. Make sure you don't dive into the shallow end of a pool. I can go on. I can go on.
This is too good.
Yeah.
This is too good. I love it. Probably a lot of motor vehicle accidents though,
huh? Oddly enough, right now it comes in waves. It's really weird. We've had a lot of people fall from height and break their calcaneus, so their heel bone, and fall from height and break their the top of their tibia, called their tibial plateaus. Okay. Motor vehicle accidents happen, but really it's those are just constant. Like those are, motor
Yeah, it's
vehicle
a
accident,
given.
motorcycle accident. Motorcycle season's rough though. That
Ooh,
is really rough
Cynthia saved my
because
life.
yeah, they don't come in and they're like, motor vehicle accident. It's like, oh, they got a broken femur or broken ankle, and it's usually kind of isolated, some rib fractures and like some head stuff. But like motorcycles, it's like, yeah, their leg is smashed to pieces and their shoulders broken and dislocated and their elbows just absolutely opened up and thrashed. And,
Yeah.
you know, it's, some of those patients are projects, like,
Yeah.
I mean, they got a lot of surgery ahead of them.
Yeah, for sure.
Yeah.
Man. Yeah, it's that's very interesting. Another thing going on over here is it's South by Southwest
Oh,
week. I guess it's like 2 weekends put together. Lots
okay.
of film and music and
Cool.
tech
Are you guys
stuff
going to
set
go?
up. So we're not going to the main thing, but they have like dozens and dozens of these pop-ups that companies sponsor, and they just want to talk to you about their products and things like that. And
Cool.
basically they just give you free food and whatever you want, and just it's just kind of a bunch of mingling events and a ton of like local bands and local artists and local filmmakers and stuff. So Cynthia RSVP just for a couple things that we're going to check out, so it'd be
Cool.
neat to check that out,
Cool.
especially since COVID's gotten so much better over here. It's awesome. So it's really good.
Awesome, man. I'm glad to hear that.
Yeah, South by Southwest and then Austin City Limits is big. That was way back when, but we got to go that next year. We're still getting settled and trying to look for a house still, but that's another podcast.
All right, man. Well, always good catching up with you.
Of
Episode
course,
10
of
in the
course, we
books.
did
Is
it.
that right? Yeah, I
Yeah.
think that's right.
Shout out to Zach's what not to do to avoid trauma surgery. I think that's going to be very useful. But do not discredit the power of sunscreen. I'll leave you guys on that. Skin and Bones is out.
Oh.